Hello, my name is Dr. Ana Cordero-Díaz, and on behalf of Dr. Oscar Valencia and Minerva Cardona, I'm presenting our work From Teacher to Mentor, an innovative faculty development program from the Tecnologico de Monterrey, Mexico. The main goal of professionalism and well-being mentoring program for medical residents is to improve residents' educational outcomes, support them to improve their personal well-being, and plan their future career. A specific faculty development for mentors should include practical tools to address the residents' professional and personal strengths and concerns. Data published in the last decade emphasized three areas of concern: medical residents' well-being, relationship between professionalism and well-being, and patient safety in the clinical learning environment. In recent years, reports as this one from the National Academy of Medicine have underscored the relevance of self-care and well-being as a professional competence, not only addressing the personal factors, but also the environmental factors through a system model of clinician burnout and professional well-being. Mentoring is really important in order to try to implement these system strategies. The successful mentoring relationship in medicine develops when a mentor with skills, knowledge, and experience provides advice, guidance, and support to his apprentice. These interactions foster characteristics and qualities in learners that allow a successful professional trajectory. Different aspects of interactional foundations to generate an environment of optimal mentoring are needed, including the emotional security, the concern for feedback, supporting the resident, that the mentoring relationship is centering the resident and treating him or her with respect as colleagues. We integrated the well-being program with the mentoring program in our institution. We follow for the well-being program of the model by the Vanderbilt Medical School of the United States, in which we integrated different services from our university, support services, we implemented group and peer strategies, and curricular design and strategies too. But we articulate the program of well-being with the mentoring program in order to attend all the to address all the mentee needs from the academic, professional development, and personal areas. Our program aims to personal and academic support to positively influence the residents' academic and personal well-being and professional development. The purpose of this mentoring program in a multi-sector program with 290 residents and 70 medical specialty programs is to implement a qualitative initiative to improve residents' educational outcomes and support them to improve personal well-being and planning their future career. A specific faculty development program for mentors was designed and implemented. Medical professors, faculty of 17 residency programs were invited to become mentors and required to accredite to specific faculty development programs for mentors. This program was integrated with 3 modules. Module 1 is Introduction to Mentoring. Module 2 is the QPR certification for suicide prevention and mental health prevention. Module 3 is a case simulation workshop. Each module was 2 hours long, and it was offered in different days. And Module 1 was to address the introduction to the mentoring programs, the objectives, the role of the mentor, and some intervening techniques and methodology. The Module 2 was the QPR Gatekeeper Certification for Suicide Prevention. This is a university-wide intervention for all the community to be trained in a 2-hour workshop in a specific technique that give tools to approach any person with suicidal thoughts and then persuade them to seek for help and to be referred to our support services and psychology departments to receive support. And the third module was about the case simulation workshop, where we provide the faculty participated with mentoring interviewing techniques, and we have a case simulation workshop with 6 different stations of cases, and where they were able to interview a simulated resident in a mentoring session, and be able to identify if the resident needed to be also referred to any of the support services that were available. So in this case simulation workshop, we have the floor map of the area where we have this workshop. And as you can see, we have 6 different stations or cases. We also have a plenary room for instructions and introduction and instruction of the sessions. But then we have these 6 different cases and scenarios where the faculty have an opportunity to do an interview, like a mentoring interview with some assimilated resident. So we have these 6 stations and 6 cases, different cases. As you can see, they were from life-work balance related, from resident burnout, substance abuse, time for family, relationship with supervisor, and even regarding some issues about nutrition and exercise. We use this case simulation training with the mentors to have one-on-one meetings with the residents, in which they will talk about the current concerns using the GROW model that I will share next. After identifying any problems or concerns in each of the mentoring categories, the academic, personal, or future career, they will design a plan, work plan, and they will schedule a follow-up meeting. If the situation warrants it, the mentor will refer the resident to the corresponding support department. So this is the GROW model that we used during the case simulation. During the introduction, we presented this model, and during the first model, we presented this the GROW model to the mentors. So as you can see, you have 4 areas: goals, reality, options, and will. So this is a coach's strategy, actually, that we adapted and implemented in this exercise, and that we consider as a very important tool to address the mentoring meeting with the resident. So the mentors were meeting with each one of these cases, as you can see on the slide. For example, one case was a resident that was really overwhelmed and burned out, and wondering if he should continue in the residency. So the simulated resident will bring this issue to the mentoring interview, and the mentor will have to use this on the right side, the GROW model, to try to explore with the residents, the issue, and mainly trying to be a facilitator for the resident himself to analyze the factors in the issue, and trying to see possibilities and also actions to try to resolve. Then also to inform him or her about the support services available, and schedule a follow-up meeting with him or her. So from August 2018 to February 2020, 122 medical professors, faculty of 16 residency programs accredited the full 3-model specific faculty development program for mentors. And additionally, just this year, in April 2021, due to the pandemic contingency, we migrated this development program to a virtual online. Our conclusion is that after completing their training, the mentors will have a real one-on-one meetings with the residents, in which they will talk about current concerns. They are meeting twice each semester, and during the pandemic, they have been doing that either face-to-face or virtually, being the Zoom platform and other online platforms the most used for that. After identifying any problems or concerns during the meeting in each of the mentoring categories, they will come up with a work plan and schedule a follow-up meeting within 3 months. And the mentor can also refer, if it is needed, the resident to a support service. So we think this is a very important initiative, not only to support the resident in his or her development, but also to address the social responsibility of supporting future healthcare professionals in their personal, professional, and future career development. Thank you very much.